Hello class, welcome back to part 3 of our section, which is the innervation of the muscle, specifically talking about the deltoid muscle, which is all here. Now, that nerve is called the auxiliary nerve, which rises from the 5th and 6th of your cervical nerve of the arm. So C5 is here and partially of C6 here. Now, the auxiliary nerve can be found inferiorly of your shoulder capsule joint, but that's just a small branch, and then some of it can be found within the pectoral major and underneath your armpit area. So within the deep tissue, within the deep muscles of that. And then it is also found medially of your humerus bone. So with the auxiliary nerve, it is branched out into two branches, which is your anterior and your posterior. Your posterior, the auxiliary nerve innervates the teres minor, which is here, and also part of that deltoid here. And then the anterior branch innerves the humerus, which is here, which runs deep into the deltoid muscle, and also the anterior head of the deltoid muscle. Now, the auxiliary nerve has two functions, which is your sensory and your motor. Now, your sensory deals with just the outer layer of your skin, which is all here, just the outer layer. And then your motor fiber acts as an abductor, a flexor, and a extender of the deltoid muscle of the glenohumeral joint, aka your shoulder. And then it also takes part with the teres minor, acting as allowing the shoulder to move into lateral rotation. Now, the auxiliary nerve can sustain injury, usually following a shoulder dislocation or a humerus fracture. This can be caused by overstretching the muscle joint or direct trauma to that area. So I'm going to use an example of wrestling. When you take your opponent and you extend it backward, and you are doing hyperextension, meaning you are taking it out of the context of extension and you are bringing it further back than it needs to be. That can cause injury to your auxiliary nerve, also giving it a shoulder dislocation. Thank you for listening.
So to give you guys a perfect image and what I was talking about with the auxiliary nerves, so your auxiliary nerves run from the subscapula here, which is also inferior of the armpit, which would be here, and then also the deltoid muscle. And then you notice that some of it goes into the pectoralis major here, and then it runs down through the humerus bone. This is more so the radial nerve, which we don't worry about, but this is just a picture of what I was talking about in the previous slide.